I've got an idea that's very simple. When a doctor walks into a patient's room to introduce themselves, "Hi, my name is Dr. So-and-so," and reach out and shake that person's hand and give them eye contact and ask them what's going on. Again, keeping the eye contact. It's just good listening skills. Show the patient that you are listening.
I definitely think that not only the doctor should be well trained in cultural diversity, but the staff as well, because that is the first person who encounters that patient coming to the counter. And if they don't know how to handle that patient, believe you me, they will not come back.
Trying to hire bilingual, bicultural staff, I think, is one of the more successful ways or the most practical ways to try to avoid the problem of miscommunication, misunderstanding, mistrust.
Often I add questions from what's called the explanatory model of illness. So some of the examples of these questions are, what do you think has made you ill? Have you consulted anybody else besides me for this illness? For example, family members, traditional healers, someone else in your community. What do you fear most about your illness? Which I really think gets a lot of good answers and helps you understand how the patient is thinking about it and what they're afraid of. And then what do you think will work and how do you think you might get better?
With a negative budget, nothing available to us, we felt we still could develop some tools that would be helpful. We did that with some illustrations, some pencil and ink type illustrations that showed various body parts and identified them in Spanish. Turned out to be a very effective point and discuss tool. We would pick homework, a word of the week, and attempt to use it every day, use it in a sentence. That really was fun. You'd see folks that if it got to be the end of the shift, they would literally grab you by the shoulder and say, "I have to get my sentence in, I have to get my sentence in, will you listen to me?" So it got to be really fun.